Hey manual therapy friends, it's Dr. David. I'm going to bring you guys today's Manual Therapy Thursday. We're going to cover a lumbar side bending mobilization. Now I love this technique. It's probably my favorite lumbar technique because I can really grab the vertebrae of the lumbar spine and create side bending, and I can tell which one's stuck, which facets don't open. I can have them flip over to the other side and check the facets on the other side as well. So you have to start off with the patient lying inside, lying like this, facing you. Then what you're going to do is make sure that your body mechanics are right. So in this case, I'm going to have my pal here slide over towards me just a bit. There you go. So that when I lean over, my body's about right here rather than right here. I won't have much leverage if I'm this way. The closer I can get my hands to my core, the more leverage I'm going to have. So the setup is like this. We're going to have his leg on the bottom, straightened out. It's okay if they're a little bent in their knee. And then just hook the toes behind the lower legs somewhere. That makes it comfortable for them. Then you're going to tell the patient to grab their wrists like so. I'm going to come under the arm so that this hand falls in the low back. And then just make sure that you let them relax this hand. Sometimes patients want to hold their arm up, their elbow up, and they don't relax fully. So always make sure that they're covered up. That makes the patient feel more comfortable. And this hand's just going to be right next to my other hand. So what I'm doing with my fingers right here is I'm feeling the interspinous space. So I can feel the spinous processes, and then I'm going to be feeling the interspinous space because I'm going to be grabbing the spinous processes to create side bending. So I'm actually going to count. I can feel the 12th rib is right here. There's the 12th vertebrae. So I'm going to start with T12 and I'm going to move L1 on it. So I'm going to just take up a little slack and rotation here, put my torso on him, and then I'm grabbing the spinous process of T12 right here. Here's the spinous process of L1, and then using a combination of mainly my arms, my forearms, I'm going to be pushing him this way into side bending, but guiding the motion with my fingertips right here. So it looks like this. And I'm thinking of grades, grade 1, 2, 3, 4, and you can even do 5 here. But we're just going to stick to grade 1, 2, 3, 4. So I'm assessing, and then once I feel that there's a little bit of restriction, I can mobilize. And you can see my body coming down, but what I'm doing with my body is I'm pushing my elbows out to push his upper spine this way and his lower spine that way to create side bending in this moment. I'm kind of pulling up the vertebrae so that they open into side bending. It would be right side bending in this case. So then you just work your way down, segment by segment, feeling and mobilizing each level as needed. So there you go. That's a lumbar side bending mobilization. I'll spend anywhere from a couple of minutes to probably 5 minutes on each side. It depends on how many restrictions I find, how restricted it is. I will do a little bit of soft tissue work from that position as well, just to free up the spine. But this is a super highly effective technique for people that are suffering from lower back problems. So guys, if you have any questions about this technique, or this is something that you already do all day long, then kudos to you. I'd love to hear how often you use it. If you are looking to refine this technique and you have some questions, hit me up. I'm ready to help you. Thanks. Bye-bye.